Good day, everyone. I am Michelle Jane Sibilia from BSN 212E Group 20, and today I am going to perform the basic life support for pediatric return demonstration. So basic life support is emergency management provided by the first responders, healthcare providers, and public safety personnel to people who are experiencing cardiac arrest, respiratory distress, or unobstructed airway. So pediatric resuscitation involves a child or an infant who needs immediate resuscitation. So basically, the steps in doing this procedure is just the same with the adult CPR, but the only difference is the number of hands or fingers used in a chest compression. So to begin, we have to check the environment and make sure that the scene is safe, and also scan the area and check for the environment for any hazard present. So a hazard could be a fire, falling debris, chemicals, or just anything that could potentially harm us, because if there is the hazard present and if we do get injured, then we will therefore be unable to help and assist the patient. So now, scene safety would also include the use of personal protective equipment such as gloves and pocket face masks, which I will be using later in performing CPR. So this face mask will make the CPR much safer and for the rescuer, as it reduces the risk of infection, and it also protects the patient from contracting communicable diseases from the rescuer as well. So next, we'll have to check the patient's level of consciousness and responsiveness by tapping both shoulders and calling out the name on both ears. And if the patient is not responding, then we'll have to call for help and activate the emergency response system. Baby, baby, can you hear me? Baby, can you hear me? Baby, baby, can you hear me? Sir in blue shirt, please call 911 immediately. We have a patient here in need of immediate care. So after doing that, we'll have to check the patient's ABCs. So the airway, breathing, and circulation. So we will have to open the patient's airway. So if the patient is wearing constrictive clothing, we'll have to loosen it up. And also we can do the head tilt, chin lift to still open the airway. Now, after doing that, we'll have to check for the patient's breathing using the look, listen, and feel method. So look for the chest rise and fall, then listen for breath sounds, and then feel for the respiration of air. So now checking the breathing and pulse. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So next, I'm going to give the patient 2 rescue breaths, and I'm going to get the face mask and cover the patient's mouth and nose with it. Now deliver 2 rescue breaths. So after that, check again the patient's breathing and pulse. Checking pulse and breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I see that the patient is not breathing and has no pulse. I'm now going to proceed with doing the cardiopulmonary resuscitation. So CPR is a life-saving skill that combines chest compression with artificial ventilation to maintain the brain function until further measures are done to restore spontaneous blood circulation and breathing of the patient who was gone into cardiac arrest. So if the patient is a child, so children are within the age range of 1 year old to 8 years old. So we'll have to perform the chest compressions using one hand, placing it on the lower half of the sternum or lower breastbone of the patient just below the nipples here. And then start giving 30 chest compressions at the rate of 100 to 120 per minute. So compress at about 2 inches only because we don't want to fracture the child's bones. Also ensure that in doing chest compressions, there is a complete chest recoil, as this allows the chest to fully expand to pull blood back into chest and the cardiac tissues. And after doing that, immediately give the patient 2 rescue breaths. Each rescue breath should be given over a second, and for every rescue breath, there should be a visible chest rise. So giving CPR, 1, 2, 3, 4, 5, 7, 8, 9, 10, 1, 2, 3, 4, 5, 6, 7, 8, 9, 20, 1, 2, 3, 4, 5, 6, 7, 8, 9, 30. Continue doing the CPR with 30:2 compression ventilation ratio for 5 cycles. So now after 5 cycles, reassess the patient by checking the pulse and breathing in not more than 10 seconds. And checking pulse and breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So now if return of spontaneous circulation is not achieved, repeat the CPR, but once the return of spontaneous circulation is achieved, place the patient in recovery position. So since my patient has a return of spontaneous circulation, and I will now put him in a recovery position. So to do this, we'll have to place the arm that is nearest to you in a right angle, and then grab the hand that is at the farther side, place at the back of the other hand on the patient's cheek, and then hold it there, then grab the farther knee, flex it, and then grab or grasp the leg to roll the patient to the side. And that is the recovery position. And after doing that, we'll have to wait for the rescue responders. And then after everything, I will have to document the time the procedure started and also the time the procedure ended.